سفر که به کابل داشتم و مصادف شد با برگزاری مجلس مجمع عمومی مجادله علیه سرطان.
I am pleased that my visit in Kabul is coincided with the meeting and as the General Assembly of Afghanistan Cancer Foundation.
در 2014 وقتی که اولین حرکت توسط دوستان مسلکی طبی و همچنان دوستانی که به مسلک طبابت ربط نداشتند دور هم جمع شدیم و یک حرکت مبارزه علیه سرطان را آغاز کردیم.
In 2014, in close coordination with the people relevant to medical field or not relevant with the medical field, we gathered, we came together and we started a movement to combat cancer and established Afghanistan Cancer Foundation.
که البته در ماه اکتبر اولین حرکت ما حرکت آگاهی دهی راجع به سرطان سینه بود.
In October month, our first move was the move on giving awareness about the cancer.
خب از اینکه بسیار فعالیت‌های صورت گرفته و نمیخوام که بسیار طولانی صحبت کنم و میخوام مختصر به سه نقطه اشاره کنم.
There have been a lot of activities in this regard, but I want to be simply brief in this regard and highlight 3 points.
تمام دوستانی که واقعاً از دل جان باورمند بودند که بر یک هدف والای انسانی که مجادله علیه سرطان است با هم گرد آمدند.
All friends who were all esteemed friends who came together to combat cancer.
و اساس گذاشتن
and established
سه کار مهمه که باید با آن افتخار کرد.
3 main activities and important activities that we have to be proud of that.
اولینش به نظر من ولانتریزم بود که دوباره آغاز شد یا کار داوطلبانه.
First activity was volunteerism that was started.
به خاطر که همه دوستان مربوط وزارت صحت عامه افغانستان بود، کارمند WHO بود، کارمندان مؤسسات مختلف بود، بعضی از اعضای پارلمان بود، نهادهای مختلف بود، با هم گرد آمدن و وقت شخصی خود را سرمایه گذاری کردند که چطور بتوانند که یک حرکت را آغاز بکنند.
All friends from WHO, from Ministry of Public Health, from different organizations came together and think on that how to start this move.
یعنی به اصطلاح ما یک بار دیگر آغازگر کار داوطلبانه بر یک هدف والای انسانی که مجادله علیه سرطان یک مرضی که حیات انسان را میگیرد آغاز کردیم.
We started and we initiated a work, humanitarian work that is combat against cancer. We started as a humanitarian activity to combat cancer.
همین اعضای داوطلب تانستن که وزارت صحت عامه افغانستان را به تشویق و قانع بسازند که National Control Cancer Program آغاز شود.
All these friends could convince Ministry of Public Health of Afghanistan in order to start the National Cancer Control Program.
میخوام تشکری بکنم از جناب ما وزیر صاحب صحت عامه، جناب معین صاحب، دکتر صاحب احمد جان که واقعاً با ما همکاری کردند.
I would like to thank His Excellency Minister of Public Health and Deputy Minister Ahmad Jan who closely cooperated with us in this regard.
میزبان برنامه‌های ما بودند.
They have hosted our events and programs.
همکار و همگام و حامی تمام برنامه‌های ما شدند.
They have cooperated with us and they have been a prominent advocate in this regard.
خوشبختانه که ما امروز این کانسر کنترل پروگرام در خود وزارت داریم که یکی از دستاوردهای بنیاد مجادله علیه سرطان است.
Fortunately, we have the program of combat against cancer inside the Ministry of Public Health, and it has been one of the great achievements.
قابل یادآوری است که باید ما تشکر کنیم از وزارت مالیه افغانستان و به خصوص جناب اکلیل حکیمی وزیر مالیه و همچنان همکار دیگر ما از وزارت مالیه که آقای ضیاءالرحمن حلیمی که فعلا در موقف خودم نیست که رئیس عمومی بودجه بودن، ما را با حد اقل کمک مالی که کردن ما توانستیم که آغازگر یک برنامه خیلی بزرگ باشیم برای آینده.
It is noteworthy that we have to thank and be grateful to His Excellency Minister of Finance and especially His Excellency Iqlil Hakimi and Deputy Minister Halimi who have closely cooperated with us and had at least a financial contribution in this regard so that we could start this movement to combat cancer.
و همچنین از دستاورد بزرگ بنیاد با ساختن یک آنکولوژی وارد، یک وارد برای امراض سرطانی یعنی بر تشخیص و تداوی در خود شفاخانه جمهوریت بود.
And also from the میشه تکرار کنین باشه؟
دستاورد دیگر خود ایجاد آنکولوژی وارد در خود شفاخانه جمهوریت برای تشخیص و حد اقل تداوی که ما بتانیم برای مریضای که مبتلا به مرض سرطان است.
And establishment of an oncology ward in Jamhuriyat Hospital so that we can detect, treat and diagnose and treat cancer.
که البته کار را وزارت صحت عامه افغانستان اجرا کردم، لکن ما کسانی که در پشت از وارد بود معلومدار همکاری اعضای بنیاد بودند.
The work has been mainly done by Ministry of Public Health of Afghanistan, but the highly cooperation has been done by the members of ACF, Afghanistan Cancer Foundation.
و باید یادآور شم که تمام کارهایی که صورت گرفت چی از برنامه یا کمپین آگاهی دهی سرطان سینه از 2014 تا امسال
I have to remind that what activities do we have in this regard, that is raising awareness on breast cancer and
برنامه‌های خاصی به خاطر روز جهانی سرطان که 4 فوریه است.
Special programs and events for the International Day of Cancer, which is on 4th of February.
خود ایجاد بنیاد مجادله سرطان.
Establishment of ACF.
ایجاد کردن وارد آنکولوژی.
Establishment of oncology ward.
این یک کار یک گروه بزرگ بودن که با هم جمع شدن و یک کار مشترک بود.
A group of people have come together and have done a great work.
لکن قابل یادآوری است که بالاتر از همه شخصی که واقعا تمامی این حرکات را حمایت بسیار جدی کرد.
It is noteworthy that the person who has immensely advocated this move
ما را جرأت بخشید.
And give courage to us.
انرژی بخشید.
And gave us energy.
امیدواری بخشید.
And gave us hope.
خانم اول جلالت مآب رولا غنی بود.
Has been Her Excellency Rola Ghani.
و همچنان میخوام یک بار دیگر تشکری بکنم از خانم اول افغانستان، از وزیر صاحب صحت عامه، از همکاران بین المللی، مؤسسات داخلی و دوستان بسیار خاص ما، دکتر صاحب میهن، دکتر صاحب ستانکزی، دکتر صاحب بهیر، خانم مبشر، دکتر صاحب احمد جان، نسرین جان وریاخیل، گلاله جان صافی و بسیار خانم های آقایان که و همچنان امروز خانمی که مسافر است و دور است، خانم فوزی علم که شب و روزی کار کرد و زحمت کشید، جایش خالی است و انشالله یک روز پس هم ما شما یک جا خواهد بود. تمام دوستانی که مرا ببخشین که نامای کلگی یاد کرده نمیتونم، وقت کم است. از کلگی جهان سپاس که امروز ما شما شاهد یک بنیادی هستیم که همکار همگام با وزارت صحت عامه افغانستان خواهد بود.
I would like to once more thank everybody who have immensely cooperated in establishment of this foundation. On the top of that, Her Excellency BP Gul Ghani and the Minister of Public Health and each and everybody who have immensely cooperated, international partners and everybody, each and everybody who have cooperated in establishment of this foundation.
و تشکر میکنم از مطبوعات افغانستان و رسانه ها که اونا هم وقت ناوقت تانستن که بعضی برنامه ها که آگاهی راجع به امراض سرطانی بودن ما را همکاری کردن.
I would like to extend my gratitude to media outlets of Afghanistan who have contributed and cooperated in raising awareness in this regard.
به امید از اینکه ما بتوانیم
I hope we can
که تمام دوستان خود را با هم دهی حرکت با خود داشته باشیم.
to convince and to have all our friends in this move, in this initiative,
بنیاد را همکاری بکنید
and to cooperate with us,
تا ما بتوانیم
so that we can
تا وزارت صحت عامه را همکاری کنیم،
so that we can cooperate with Ministry of Public Health,
تا وزارت صحت عامه بتواند یک روزی
and the Ministry of Public Health can one day
شاهد ایجاد یک شفاخانه که بتونه تشخیص به وقت و تداوی برای مریضان سرطانی کرده
so
بتونه.
that Ministry of Public Health one day can witness the establishment of a hospital that can detect
خانم محترمه خانم کروخیل بسیار تشکری کنم. او میگه که راستی که یک گروپ جمعی امی کار ما کار ما نتیجه گروپ جمعی بود.
At the beginning, I would like to thank Ms. Karukhil. In fact, indeed, our work has been a group work, a team work.
ولی باعث امی کار خود خانم کروخیل بود. یک روز اومد پیش ما مرشان سر کوچ گفته بود گوش کنی باید یک نهاد سرطان شو.
But the cause to start this, the reason and the cause to start this move was herself, Ms. Karukhil, who one day came and talked to me in this regard and said, we have to start a foundation for cancer, to combat cancer.
هنوز در وقت ما بسیار زیاد توجه نداشتم به سرطان. منتها اصرارش قوی بود که ما گفتمش خب وعده میکنم که یک چیز میکنیم.
She was able to convince me with her strong words so that I promised that we will do something in this regard.
علی فعلا زیاد دقیق در تاریخ بنیاد نمیرم چون خودش زیاد برایتان معلومات داد.
I don't want to talk over the history of the foundation. She gave full information in this regard.
و فکر میکنم که در آخر این جلسه اول یک راپور کامل از دکتر میهان دقیق میگه که کلی انجام که و دستاوردهای بنیاد میشن.
At the end of the event, Dr. Mehan will provide you and brief you about a report with regard to the achievements and activities that have been done in this regard.
تنها میخواستم همینجا تکرار کنم که چقدر مهم ایجاد همین نهاد است.
I'd like to reiterate here that how important is the establishment of this foundation.
شما کلتان که همینجا هستیم حتما علاقه دارین به مرض سرطان میفهمین و میفهمین که اهمیت طب وقایعی چی کلان است.
Every one of you who have been around this table know that how important cancer is and how important the preventive care is for cancer.
و یکی از اهداف امی بنیاد سرطان که آگاهی اما بخش شود در تمام افغانستان که مردم زود بفهمند که چی وقت باید مراجعه کنند به یک کارمند صحت و ببینند که آیا مبتلا به سرطان شدن یا نه.
One of the main objectives of this foundation is to so that people who are suffering from cancer or people know when to refer to doctor to see if they suffered from cancer or no. To give awareness and raise awareness of people across Afghanistan so that they can refer in a timely manner to the doctor and detect it on early stages.
شما البته کلتان به دستتان امی اساسنامه که تجدید شده باید همینجا برایتون بسیار مختصر بگویم که چطور به زینمی amended اساسنامه رسیدیم.
I want to tell you that how we came to conclusion to devise this mandate that is in front of you.
رقم که فهمیدیم امی دو نفر مهمترین نفر که ای انجام با وجود آوردن، خانم کاروخیل و خانم علم، هر دویشان مجبور شدن که بیرون برن. بعد از او البته دکتر میهن بسیار تلاش کرد که امی نهاد دوامدار باشه و کارایی کنن. منتها انسجام ما بین اعضای نهاد زیاد نبود.
Two important people who have immensely worked in this regard were Ms. Karokhel and Ms. Alam, and Dr. Mehan also underscored that this foundation should sustain. At the beginning, the coordination and consistency was not that much between the members of the foundation.
Maybe I did not express myself well in Dari, so I'll carry on in English. What I was trying to say is that the two most important people who put this foundation together and gathered people were compelled to leave the country, and one became ambassador in Canada and the other one had to attend to family business in Germany. So Dr. Maihan was left alone to carry all the load, and unfortunately the members were not part of that process.
همانطور که ناف خانم اول فرمودن، دو شخص مهمه که بنیاد را بنیانگذاری کردن مجبور بودن کشور را ترک کنن. یکشون خانم کاروخیل مجبور بودن به کانادا برن و خانم علم به خاطر کار شخصی که داشتن باید به ژرمنی میرفتن. بنابراین تمام مسئولیت نهاد به دوش آقای میهن افتاد و در ابتدا هماهنگی زیادی وجود نداشت.
I'll continue in English, okay? It will be easier for everyone. Around the month of November, I decided to start looking into what the foundation was doing. I am an honorary member, مایک عضو افتخاری. وجود ما امروز یک کمی استثنایی، ما زیاد مداخله نمی کنم، ولی یک کمی ورخطا بودم که امی نهاد باید باز احیا شود.
Actually, I am a honorary member of this foundation, and I was in a hurry that this foundation should be revived and extended.
So I think in December we had a meeting of maybe 15 to 17 people. I don't remember the exact number, but we tried to gather as many members that we know were members of the foundation around the table. And we discussed and we decided that indeed we needed to reconnect the members with the foundation. And this is what we did.
ما تلاش‌های زیاد تلاش انجام دادیم تا از 15 الی 17 عضو که این بنیاد داره و تا که میتونیم که اعضای بیشتری را بتونیم جمع کنیم در این بنیاد که با همدیگر کار کنن.
And our first decision was to reread the bylaws. اولین قرار که گرفتیم که اساسنامه پس یک مرور کنیم. And when we read the bylaws, we decided that there were a lot of parts that needed to be clarified, not changed, clarified.
اولین تصمیم گرفتیم می بود که اساسنامه را یک مرور کنیم و بعد از او تصمیم گرفتیم که بعضی از مواد از این واضح‌تر بسازیم، نه که تغییر بدیم.
And the result is the اساسنامه that you have in front of you.
و نتیجهش هم همین اساسنامه است که در مقابل شما قرار داره.
So this is why today, in any case, the bylaws, the initial bylaws said that the board of director is for 2 years, and we are approaching the end of the 2 years of the first board. This is why today we are here first to vote about the new Asasnama, because as members you need to approve the Asasnama, and I hope you have read it. And we also will later proceed with voting for the board of directors.
دلیل اصلی که شما در اینجا حضور داره این است که اولتر از همه بتونیم که اساسنامه را در مورد اساسنامه رای گیری کنیم و بتونیم او را تصویب کنیم و بعد از او بتونیم که رؤسای بورد که کاندیدا هستند در هر انتخاب کنیم و گزینش کنیم.
So I hope everything will work smoothly. We have worked on it quite a few, we have had quite a few meetings about it. But once this is done, which will be done by, I hope, by 12:30 today, I will consider my role done. I would have put back together the members who were there. It's not that I brought them. They were there, I just brought them back together. And we discussed again how we were going to run the foundation. And after that, it will be up to the members themselves to.
برای شما بهتر معلوم است از نظر اپیدمیولوژی وضعیت صحی مردم افغانستان، یعنی مردم ما هم از امراض ساری و هم از امراض غیر ساری رنج میبرند.
It is clear and obvious that people of Afghanistan are suffering from both kind of sicknesses and diseases, epidemic and non-epidemic diseases.
No, suffering from communicable disease and non-communicable disease means dual border of disease.
The technical words, I'm sorry if I don't know.
و خصوصا امراض غیر ساری یا non-communicable disease که سرطان از جملهش است، در افغانستان روز به روز وقوعاتش زیاد میشه.
Like cancer, which is a non-communicable disease in Afghanistan, which is spreading daily in Afghanistan.
با طولانی شدن عمر
with people with a high age
و ارقامی که تخمین شده تا سال 2030 این واقعات سرطان احتمالاً تا 50% نه تنها در افغانستان بلکه در اکثریت کشورهای رو به انکشاف.
According to statistics that has been estimated, up to 2050, the statistics of cancer and cases of cancer will be up to 50%, not only in Afghanistan, but across the world.
با در نظر داشتی ارقام
with consideration to these statistics and figures
و همکاری بنیاد مجادله علیه سرطان افغانستان
and cooperation of Afghanistan Cancer Foundation,
برای اولین بار پروژه تشخیص و تداوی امراض سرطانی
for the first time the project to diagnose and treat cancer diseases
در چوکات وزارت صحت عامه افغانستان شروع به فعالیت نمود.
has been started operation within the structure of Ministry of Public Health of Afghanistan.
و این بسیار واضح بگویم
I have to clarify it that
بدون حمایت جلالتمآب بانوی اول
without support and advocacy of Her Excellency the First Lady,
خانم شینکای کروخیل
Ms. Shinkai Karukhel,
و تمام دادخواهان بنیاد مجادله علیه سرطان
and all advocates of Afghanistan Cancer Foundation,
که ذکر نامشان تک تک از حوصله مجلس بیرون خواهد بود.
which we cannot enumerate everybody's name.
یعنی بدون کمک از یا ناممکن بود که ما این پروژه تشخیص و تداوی را در وزارت صحت عامه افغانستان ایجاد کنیم.
It was impossible to establish this project, the project of treatment and diagnose and treatment of cancer in Ministry of Public Health of Afghanistan without their support and advocacy.
همچنان با همکاریشان
Also with their cooperation,
طی یک سال گذشته
within the last year,
این پروژه تداوی سرطان
the project of cancer care and treatment
با برنامه ملی کنترل سرطان تبدیل شد.
has been turned into a national program of cancer national program.
که برنامه یا اهداف کنترل برنامه ملی کنترل سرطان عبارت است
This program consists of
کاهش وقوعات سرطان توسط وقایع ابتدایی،
reduction of to reduce cancer cases with preventive care,
افزایش میزان تشخیص در بین
increase the level of increase the level of detection and diagnosis,
عرضه خدمات معیاری بعد از تشخیص،
delivering quality services after detection and diagnosis,
فراهم‌آوری خدمات مراقبت‌های مایوی،
provision of supportive care services,
جمع‌آوری ارقام
collection of figures,
و ارتقای ظرفیت پرسنل که در این بخش کار می‌کنه.
and capacity building of the personnel.
با طور خلاصه عرض کنم در مورد وقایع،
In brief, I want to highlight about the preventive care.
وزارت صحت عامه با همکاری بنیاد مجادله علیه سرطان
Ministry of Public Health in cooperation with Afghanistan Cancer Foundation
بعضی پالیسی‌ها و قوانین به سطح ملی انکشاف داد.
have formulated some policies and regulations at the national level.
به طور مثال قانون منع تنباکو
For
یا قانون
example,
کنترل تنباکو،
the law on control of tobacco,
همچنان طرح تطبیق واکسین HPV برای دختران نوجوان.
and the vaccination of the plan to implement the vaccination of HPV vaccine for young girls
که میتونه سبب وقایع سرطان عنق رحم شود.
that can prevent from the cervical cancer.
در مورد میزان افزایش میزان تشخیص،
On increase the level of detection and diagnosis,
آموزش پرسنل صحی
training of health
و
personnel,
ایجاد آگاهی و انگیزه برای مردم.
and creating motivation and awareness for people,
و ایجاد برنامه‌های اسکرینینگ
and creation of screening programs
در مرکز و ولایت افغانستان.
at the center of capital and provinces of Afghanistan
در مورد عرضه خدمات،
on delivery of services.
روزانه بیش از 60 مریض در مرکز تشخیص و تداوی سرطان مورد تداوی قرار میگیره.
Daily, more than 60 patients are treated and diagnosed and treated in National Center of Cancer.
و در یک سال اخیر در حدود 13,000 هموطن مبتلا به سرطان تداوی شده.
And within the last 3 years, within the last 1 year, more than 13,000 countrymen have been treated with cancer.
در مورد جمع‌آوری ارقام،
On the collection of data and figures,
کانسر رجستری را در شفاخانه‌ها شروع کردیم
we have started cancer registry in hospitals,
و انشالله با حمایت بنیاد مجادله با سرطان
and with the support of ACF,
کانسر رجستری را در بین نفوذ یا در بین مردم شروع خواهیم کرد.
we will initiate and start the cancer registry among public.
با
and
گفته‌های
population.
خود خاتمه بتم
I want to conclude
که بدون حمایت بنیاد مجادله علیه سرطان
that without the support and advocacy of Afghanistan Cancer Foundation,
ممکن نبود که ما این دستاوردها را داشته باشیم
it was impossible to have these achievements.
و امیدوار هستیم که کمک و حمایتشان دوام کنه
I hope their advocacy and support sustain.
با امید اون روزی که تشخیص و تداوی مقدم در افغانستان شود
I hope one day the diagnosis and treatment would happen and would take place in Afghanistan,
و افغانای ما از احتیاج بیرون رفتن نجات پیدا کنند.
and our countrymen are not in need of going out of the country for treatment.
یک بار دیگر از جلالت ما بانوی اول تشکری میکنم
I would like to extend my gratitude once more to
به
Her
خاطر
Excellency
حمایت دوامدارشان
for her support, long
نه
support,
تنها از برنامه کنترل سرطان
not only for cancer control program,
بلکه از اکثریت برنامه‌های وزارت صحت عامه.
but for her support for majority of programs of Minister.
وزیر صاحب مالیه نسبت به علاقه‌ای که به این موضوع دارن
Minister of Finance, due to his interest to this issue,
و چون امروز عازم سفر هستند به اجلاس سالانه بانک انکشاف اسلامی
and he's not present here. He is attending an Islamic Development Bank Summit.
از من خواستن که پیامشان در این مجمع قرائت بکنم.
His Excellency asked me to deliver his message here in this event.
پیام وزیر مالیه به مناسبت برگزاری مجمع عمومی بنیاد مجادله علیه سرطان افغانستان.
Message of Minister of Finance of Afghanistan on the Afghanistan Cancer Foundation General Assembly.
قبل از همه میخواهم از دعوت شما در مجمع عمومی امروزی بنیاد مجادله علیه سرطان افغانستان به حیث یکی از اعضای این بنیاد سپاسگزاری نمایم.
First of all, I would like to extend my gratitude to all of you for inviting me as one of the members of this foundation to this event.
از اینکه سفر رسمی که دارم مصادف با برگزاری این مجمع قرار گرفته.
As my official visit is the holding of this event is coincided with my official visit.
پیام خویش را با وسیله همکارم خدمت شما تقدیم می‌کنم.
I would like to present my message by my colleague to you.
با تأسف باید یادآور شد که تاریخ بشریت با چالش‌های مانند امراض مزمن روبرو است.
Unfortunately, I have to remind you that human history has been facing with different challenges such as numerous diseases.
یکی از این امراض که تا حال برای جهانیان خطر بزرگ محسوب می شود امراض سرطانی است.
One of these diseases, which is a big risk, a big danger for all over the world, is cancer.
متخصصین و سازمان‌های صحی جهان پیش بینی کردند که آمار افراد مبتلا به سرطان الی سال 2030 سالانه به 30 بیلیون خواهد رسید.
The officials in medical areas have anticipated that the cancer cases all over the world, with up to 2030, will reach to 30 million people.
که این رقم تکان دهنده است.
This is a shocking figure.
اما لازم است تا یادآور شویم که تکنولوژی و امکانات عصر حاضر
And it is to remind that the technology and facilities in the current era
در قسمت تداوی و وقایع امراض سرطانی پیشرفت قابل ملاحظه نموده است.
in the area of treatment and available in the area of diagnosis and treatment of cancer cases and cancer diseases.
حکومت جمهوری اسلامی افغانستان نیز خطرات موجودیت و ازدیاد امراض سرطانی را درک نموده.
The Afghan government has understand and realized the existence and the danger of cancer diseases and cases,
و در زمینه متحد بوده
and committed to
تا در عرصه مجادله و کنترل این امراض از هیچ نوع سعی، تلاش و حمایت دریغ نورزد.
The government is committed to spare no efforts in combat with this disease, cancer disease, and extend their efforts in this regard.
چنانچه برنامه ملی کنترل سرطان
As the National Program of Cancer Control
در سال مالی 1395 شامل بودجه انکشافی وزارت صحت عامه
in 1395 fiscal year was included in the national budget of Minister of Public Health
به منظور جوابگویی به نیازمندی‌های مبرم مردم افغانستان
in order to attend the needs, essential needs of people of Afghanistan
در عرصه وقایع،
in the area of prevention,
تشخیص مقدم،
early detection,
تشخیص و تداوی،
diagnosis and treatment,
مراقبت‌های حمایوی
supportive cares,
و ثبت ارقام امراض سرطانی گردیده است
and registration of cancer cases figures,
و در حالت تطبیق قرار دارد.
and it is being implemented.
وزارت مالیه به منظور عرضه بهتر خدمات صحی
Ministry of Finance, in order to deliver better health services,
طرح این برنامه را تایید
has approved the plan of this program and plan,
و در بودجه ملی سال مالی 1397
and in national budget of 1397 fiscal year,
مبلغ بیش از 34 بیلیون افغانی را جهت تطبیق آن تخصیص داده است.
the amount over 34 million Afghanis have been allocated to implement this plan.
علاوه به ادامه این اقدامات در مورد ایجاد مکانیزم همکاری‌های علمی
In addition, in establishment of scientific cooperation mechanism
با نهادهای تحقیقاتی
with research institutions,
امراض سرطانی و مراکز صحی
research institutions of cancer cases and other institutions.
مراکز صحی معتبر ممالک دیگر تبادل نظر نمودیم.
They have exchanged views with credible health institutions of other countries.
سال قبل بنابر دعوت بانک انکشاف اسلامی
Last year, at the invitation of Islamic Development Bank,
جلالت مآب نرگس نهان که یکی از حامیان این مجمع هستند
Her Excellency Nargis Nawan, who is one of the advocates of this forum,
با هیئت این بانک
with the delegation of
this bank مرتبط به این موضوع صحبت داشتند
discussed with regard to this issue,
و در زمینه مبارزه با این امراض مهلک
and in the area of combat against these lethal diseases,
تعهدات لازم را دریافت نمودیم
and received the required commitments in this regard,
و تلاش های ما همچنان ادامه خواهد یافت.
and our efforts are going on in this regard.
در نتیجه
In result, in conclusion,
امروز بنابر اهمیت حیاتی این موضوع
today, based on the importance of this vital issue,
طی سفر خویش یک طرح پیشنهادی جامع را
during my visit, a comprehensive proposed plan,
را شخصا به رئیس عمومی بانک انکشاف اسلامی
I'll propose this plan in the General Summit of Islamic Development Bank
در جریان 43مین اجلاس سالانه این بانک پیشکش خواهم کرد.
during the 43rd session of this 43rd summit of this bank. I will present this plan.
وزارت مالیه مصمم است تا در سالهای آینده پلان و برنامه‌های جامع و مؤثر را
Minister of Finance is decisive and determined to, within the next year's comprehensive annual plans,
به سطح کشور حمایت نموده
to support these plans across the country,
و در امر مبارزه با این گونه امراض خطرناک
and in the area of combating such lethal diseases,
مسئولیت ملی خویش را به وجه احسن ایفا نماید.
fulfill its responsibility in this regard.
در اخیر ما امید روز را داریم که نه تنها افغانستان بلکه جهان
At the end, I hope that not only Afghanistan but the world
از این پدیده کشنده به صورت کامل نجات یابد.
will be saved from this lethal phenomenon.
با ابراز امتنان اکلیل حکیمی وزیر مالیه.
Thank you very much, Eklil Hakimi, Minister.
چنین کمپاین ها و چنین مجالس می باشند.
Media that has always been the ear and eye of this kind of events and reflected such events.
بسیار خوش هستم که در این محفل که در مورد جلوگیری از مرض مهلک سرطان که سالانه در حدود 15 میلیون کیس جدید در سرتاسر جهان دریافت می شود.
I'm pleased to attend such a meeting that is discussing on the cancer cases, which around the 15 million cases of this lethal disease is identified across the world.
و در حدود 9 میلیون انسان در سال از سبب این مرض از بین میره.
And around 9 million patients are dying of this lethal disease yearly.
22,000 انسان در روز تلف می شوند.
And 22,000 people and humans are losing their lives on a daily basis.
در جمع شما دوستان هستید.
I'm pleased that we are among you.
موضوعات بسیار مهم بزرگواران قبلا ارائه کردن، وقت بسیار کم است.
As we are in shortage of time and important issues were discussed and mentioned before.
مگر بیاین که قضاوت بسیار عادلانه کنیم که شما میبینید که در ساحات بسیار بزرگ طبابت رول خانم‌ها بسیار برجسته است.
Let's fairly and judge this, that the role and role of women in broad area of medical affairs is very broad and extensive.
رئیس شورای طبی افغانستان،
Head of Medical Council of Afghanistan,
رئیس بورد مبارزه علیه کانسر،
the head of board Combat Against Cancer,
سکرتر جنرال سرمیاشت
Secretary General of Red Crescent,
و در ساحات مختلف
and in different areas.
رول خانم‌ها بسیار برجسته در افغانستان است.
Women are playing broad roles inside Afghanistan in
بنابراین به
different areas.
افتخارشان یک کف بزنید. راستی هم مرض سرطان در ممالکی که انکم بسیار کم و متوسط دارند بسیار متبارز است.
The cancer disease cases in the countries, in the underdeveloped countries, are very significant.
افغانستان یکی از ممالکی است که بسیار آسیب پذیر از سبب این مرض مهلک می باشد.
Afghanistan is one of those countries vulnerable of this disease, lethal disease.
بهترین راهی که ما بتانیم این مرض مهار بکنیم
The best way that we can control this disease
قبل از تشخیص و تداوی
before diagnosis and treatment
مهار کردن فاکتورهای خطر مرض است.
Is to contain the factors, the risk factors of the disease.
اگر بتانیم از منابع داخلی کشور استفاده بکنیم
If we can use and utilize domestic resources inside the country,
مطمئناً که در حدود 70 الی 80% ریسک فاکتورها یا فاکتورهای خطر مهار می شود.
we are sure that 70 to 80% of the risk factors are contained.
با وجود که میدانیم دوستای بین‌المللی همکار بسیار نزدیک ما هستند،
As we know that our international partners are our close friends in this regard,
بیاییم که با هم تعهد بکنیم که
let's make a commitment that
از منابع داخلی مملکت، از منابع مغزی و فکری مملکت استفاده بسیار خوب بکنیم.
let's use and utilize the domestic resources of the country and intellectuals of the country inside the country.
پلان بسیار خوب بسازیم.
Devise good plans.
وقایع را در نظر بگیریم که چطور بتانیم راههای وقایعی را تجسس بکنیم.
We have to consider prevention and preventive care, that how to seek preventive ways.
چطور بتانیم با موقع مرض تشخیص بکنیم یا دریافت بکنیم.
How we can detect it in early stages, or how can detect it in a timely manner.
بعداً میریم به طرف تداوی.
And then we can go towards the treatment of this disease.
اگر چنین پلان قدم به قدم ایجاد نشود،
if we are not devising such a plan that is going step by step,
تشخیص در وقتی که ناوقت باشه و تداوی در وقتی که مرض انتشار کرده باشه و از استیج تداوی خارج شده باشه بسیار مایوس کننده است.
It is disappointing that the diagnosis in the advanced level of this disease would be very disappointing.
بسیار ساده است که ما بتانیم فاکتورهای خطر مانند فاکتورهای خطر داخل خانه و بیرون از خانه را تفکیک بکنیم.
It is very important that we can seek and we can pursue the risk factors inside the home and outside the home.
با طور مثال میتونیم ما تبلیغات داشته باشیم، میدیای محترم تشریف دارن.
For example, we can have advertisement media present here.
اگر یک ساعت برنامه‌های تکراری خود وقف چنین کار بکنن،
if they dedicate 1 hour of their repeated programs to this issue,
ما میتونیم آگاهی بسیار خوب به جامعه بکنیم.
we can provide awareness, proper awareness to the society.
ما میتونیم به سطح منزل یا این دور تبلیغات داشته باشیم که بخاری، زغال، دود همه سرطانزا است.
we can have advertisement inside, indoor advertisement, and inside the home that heaters, coal, smoke, they're all causes of cancer.
و یا فاکتورهای جامعه یا outdoor یا بیرون از منزل همه ما شما میفهمیم.
And we all know about the outdoor factors.
ما میدانیم کسایی که در معدن زغال سنگ کار میکنن.
We know those who are working in the coal mines and the coal.
کسایی که در امراض ارسنیک سر کار دارن.
میشه تکرار کنید بخش؟
خیر است. با ارسنیک سر کار دارن.
Seismic.
ارسنیک یک مواد
Yeah, those who are facing and are in contact with arsenic.
و یا به صورت عام کسایی که از نظر وظیفوی در ساحاتی که ذرات سرطانزا وجود داره کار میکنن.
Those who are working in the areas with presence of cancer infected.
تبلیغات به سطح ساحه وظیفوی و در بیرون با ایشان داشته باشیم.
Advertisement should be in the area of job location and outdoor.
و همچنان میتونیم نوعیت غذایی، استفاده از میوه، ترکاری، چاقی، جلوگیری از چاقی، فعالیت فیزیکی، ایمونایزیشن که ولی ثبت کردن جلوگیری از اشپالیری برای سرطان‌های معده و یا واکسین‌های HBS یا هومن پاپیلوما ویروس که ولی ثبت کردن، اینها را میتونیم بسیار به سادگی مهار بکنیم.
We can contain this disease through different kind of types of advertisement, like types of food that we are consuming, vegetables, fruits, and also physical activities, and that sort of activities to provide advertisement and awareness in the society so that we can simply contain this kind of disease.
و به جامعه تفهیم کنیم که 50% مریضان سرطان تداوی شده میتونن.
And we
زندگی نرمال خود میتونن داشته باشن.
We can provide this understanding to the society that 50% of the cancer cases can be treated.
و مایوسیتی که در قبال سرطان و وفاتی که در جامعه در قبال سرطان یا مریضهای سرطان است، این ما برطرف کنیم. و جای شک نیست کسایی که سرطان دارن همیشه احساس میکنن که عمر ما بسیار کوتاه خواهد بود، ما از بین خواهد رفتیم و فامیلشان مایوس است، خودشان هم مایوس هستند. ما میتونیم توسط تبلیغات خود بسیار به سادگی علمی ساحه را و این مایوسیت از بین ببریم.
It is clear and obvious that those people who are suffering from cancer, they are very disappointed and they are always repeating that we are dying, we are about to die, and that sort of thing. Through advertisement, we can remove and we can eliminate this kind of hopelessness and disappointment.
ما 3-4 دقیقه وقت اضافی از شما خود گرفتم.
I will request for 3 to 4 minutes more time.
موضوع دوم موضوع تحقیقات است. عرصه تحقیقات است.
جناب دکتر صاحب اگر کم کوتاه‌تر بگیریم به خاطر از اینکه وقت برنامه بسیار کم است.
خب ما میایم در سر راستن در بخش مرکز جامعه تشخیص و تداوی سرطان که در شفاخانه علی آباد ایجاد میشه.
I'll discuss on the Center of Cancer Treatment, which will be established in Ali Abad Hospital.
در مساحت 6000 متر مربع.
In the area of 6,000 square meters.
که 2500 متر مربعش صرف برای تعمیراتش است.
That 2,500 square meters of that is dedicated to the buildings.
105 اتاق خواهد داشت.
It will contain 105 rooms.
2 ماشین لینک جابجا خواهد شد.
And 2 ماشین چی؟
لینک یک ماشین مخصوص است.
2 liner machines will be available.
و با 4 زون افغانستان هم در مرحله دوم مراکز سرطان ایجاد خواهد شد.
And in 4 zones of Afghanistan, on the second phase, the cancer treatment center will be established in 4 zones of Afghanistan on the second phase.
بخش تعمیراتیش با کمک دولت توسط وزارت محترم مالیه تمویل میشه که از وزارت محترم مالیه اظهار سپاس میکنیم.
Construction of this will be funded by the government, Minister of Finance, that we are grateful for that.
و بخش ترینینگ و تجهیزات توسط آژانس انرژی هسته‌ای جهان کمک میشه.
and the training and the training area will be funded by Atomic Energy Agency.
پوهنتون دیپارتمنت مربوطه را هم تأسیس کرده. دیپارتمنت کانسر تراپی را تأسیس کردیم در داخل
We
پوهنتون
have
تیپکال.
established and founded the Department of Cancer.
و پلان یک سرویس تداوی امراض سرطانی را هم داریم با کمک وزارت محترم صحت
We have a
عامه
plan of cancer treatment services in cooperation with Minister of Public Health
و فاوندیشن کانسر.
and the Afghanistan Cancer Foundation.
و این به تعقیب ایجاد اولین مرکز شعاعی در افغانستان 60 سال قبل بود که توسط انرژی هسته‌ای جهان تأسیس شده بود.
All this comes after establishment of the first Shari Center 60 years ago, which was established 60 years ago inside Afghanistan.
تعدادی از اساتید و پرسنل مسلکی به خارج از کشور توسط آژانس روان شدند به خاطر ترینینگ.
A number of experts and expertise have been sent to the foreign countries for training by the Atomic Energy Agency.
تعدادی هم دوباره برگشت کردند که عملاً در فاوندیشن همکار هستند.
A number of those people have returned to the country and they are cooperating with the foundation.
بنان ما از جانب وزارت محترم تحصیلات عالی، جناب وزیر صاحب تحصیلات عالی که در سفر هستند، ریاست پوهنتون طبی کابل تعهد همکاری را با این فاوندیشن داریم و همکار بسیار نزدیک هستیم. واقعاً که بدون همکاری همه جانبه با هم فاوندیشن و وزارت محترم صحت عامه نمیتونن که کارها را به درستی پیش برن. نیاز به کمک همه ما شما دارن، چه در عرصه پلیس، چه در عرصه وزارت تحصیلات عالی و همه افراد مملکت در سطح خودش.
His Excellency Minister of Higher Education, on behalf of Minister of Higher Education, and we have cooperation with this foundation, and without cooperation of international colleagues, all these people, it is very difficult and tough to move forward all activities regarding this foundation.
با امید مهار کانسر در افغانستان. تشکر از حضورمندی شما.
So I just want to say I'm very honored to be here with you today in this important event of the Afghanistan Cancer Foundation and the Second General Assembly. I was here last year, and it was also a big event, but this I can see it has really grown in importance. And I want to make a point, having worked in other countries with foundations like this, and I think the First Lady referred to that also in our small meeting before. The Afghanistan Cancer Foundation, as a professional association, I think will play a very important role by creating these enabling environments for the health sector and to address cancer prevention, treatment and care through advocacy, through creating public awareness, which you're doing right now, and through engagement, stimulating also and supporting research. I've seen this as well in quite a few other countries, and helping to improve government policy and plans. And of course, last but not least, very important, resource mobilization. And professional associations can play a key role in government policies and plans when it is based on facts and moving forward. Unfortunately, I think we probably all know a family member, a friend who has a colleague who has suffered from cancer, who has maybe recovered from cancer, but who also passed away from cancer. And the statistics, and I think it was the minister and I think also the professor and First Lady, they all refer to that. It's rather alarming. And I will not go into details because I think there was a lot of speeches. I will try to shorten this, but it's a few statistics. We all know that cancer is one of the leading causes for morbidity and mortality worldwide. And if you go back, I went to some of the data within WHO, and in 2012 we already talked about 14 million cases. Well, that has expanded quite dramatically. It's the second leading cause of death globally, to nearly 1 in 6 deaths, and was responsible for 8.8 million deaths in 2015. And more than 70% or close to 70% of these deaths from cancer, they occur in low and middle income countries like Afghanistan. And the number of new cases is expected to rise dramatically over the next 2 decades, and estimates are that it could be as much as 70%. So then it will be very much the leading cause of morbidity, definitely the leading cause of death. The economic impact of cancer is dramatic. I mean, and that is already in 2010, so we are now 2018, 2010, it was already estimated that the economic impact was more than US $1.2 trillion. So these are some of the facts. And I think WHO tried to do an estimation in Afghanistan, which is for all reasons difficult. I mean, and that was in 2016. And then we came to that approximately cancer accounted for 6% of the deaths of all non-communicable diseases. Among women, and I think that was, I think, also referred to, it's mainly breast, cervical, and uterus cancers were highly prevalent. And among the men, mainly stomach and esophageal cancers. We all know that late-stage presentation and inaccessible diagnosis and treatment are common in low-income countries, and is also a big problem, I think, in Afghanistan. And only 1 in 5 low and middle-income countries have the necessary data, and I think it was referred to as well. We need better data to drive a better cancer policy and plan. And only 26% of low-income countries reported to have pathology service, good pathology services in the public sector, and less than 30% of treatment services. Prevention, and I think it was referred to by all speakers, including what I understand very much by the First Lady as well, is highly cost-effective, and is very much a key part of course, battling cancer. However, we have to realize, and we all know that millions will still develop cancer because not all cancers are preventable. And detecting cancer at early stages, therefore, becomes so incredibly important. We shouldn't forget the palliative and supportive care. I want to go now, focus a bit on Afghanistan as well again. The Ministry of Public Health and Dr. Feroz actually referred to some of the progress made over the last year. Currently, the Ministry of Public Health, together with WHO and Ministry of Public Health, the National Cancer Control Program, I work very closely with Dr. Maihan there, but also with my own team, Dr. Cipriya and Adela and Safi. We are engaged with the International Atomic Energy Agency to conduct a mission comprising of cancer experts in Afghanistan, and both from the IEA, both from WHO HQ and the regional level, and of course from the government and the key hospitals here during the first week of May. And we really pushed, because we always were invited to Vienna or to Lyon. And we say it doesn't make real sense. You have to come here. We have to do the assessment here and involve as many people as possible. And we had a lot of issues with security, if they could come. And then we said, we live here, we work here, I'm traveling around, you can come as well. So finally we convinced them, and they are being the first week, with the main objectives are to assess the current national cancer control capacities, but also to need focusing on effective implementation of radiation medicine program, a regulatory infrastructure. Dr. Feroz alluded to that as well, the cancer registry, for example, for radiation safety, and identify priority interventions for cancer control and support a cancer strategy formulation based on the local situation and the priority interventions, which are known for best buys for cancer in prevention and control. That will also be, and I hope we will also be able to meet you, Madam First Lady, that there will be an opportunity, I think, to draw some national, international attention for resource mobilization, that we have to use this well. And to establish and improve cancer prevention and treatment and care services in the country. I want to dwell a bit from my speech. Recently, I'm traveling quite a bit within Afghanistan, and recently I was actually with the Deputy Special Representative. I was on a couple of missions to Uruzgan, to Helmand, to Kandahar, to the borders, etc. And in Helmand and both in Uruzgan, we had extensive visits at the provincial and regional hospitals, but also emergency hospital in Helmand, as you all know. And of course, being a medical doctor myself, having worked a long time ago at district level, so I know all the priorities from a very low-income country. And Afghanistan has a tremendous amount of priorities. And if you go to Helmand and you see emergency hospital, it's full, it's all trauma care which need to be supported, and we are very happy to support that as well. But we also realize, and I think the minister mentioned that as well, that non-communicable diseases is a priority too. And non-communicable diseases, be it diabetes, be it cardiovascular diseases, and of course what we discussed today, cancer. And I think it's very good that I want to make a point. This is my 5th year in Afghanistan, and I've worked in many different countries, very low-income countries, countries in conflict. I think Afghanistan has a pretty comprehensive public health approach, which it should be proud of. You were the ones who focused on the so-called packages, the BPHS, basic package of health service, and essential package of hospital services. You were the ones who also thought about maybe there should be a distinction between government, the one who actually controls the fund and who wants implements. So you went into this contracting out. Now we all know that there's room for improvement. We all know that there is efficiency gains to be made within the current system. However, I want to make a real plea, and it's very good that the Minister of Mines is here, but also the Minister of Finance is here, and that you are here, and the First Lady. I want to make a real plea. We can make some efficiencies in the sector, but those are limited. We need to increase our investments in the BPHS and the EPHS packages. We need to get more domestic resource mobilization, so I'm looking to my colleague on Ministry of Finance, and we need to look also at partners. A lot of donors think that we invest a lot of money in the health sector in Afghanistan. I was just with Dr. Ahmadjan in Ghana for an important meeting to raise more funds for Afghanistan through the Global Finance Facility. And I already told them, I've worked in many African countries, and actually the per capita investment in many of those very low-income countries in Africa is much higher than in Afghanistan. And they come often to $20 per person. Yes, I will close. And we come to $5 to $6 per capita. So I want to make a strong plea that we have to do more on domestic and international resource mobilization and really expand. And we have a chance now. We're looking at those packages to include the NCDs in a priority. We cannot do everything. We have to focus on some key priorities on prevention, treatment, and care. But we have an opportunity now, because that will only be the road to universal health coverage. I would like to, again, to thank you for this occasion and also take this opportunity to assure the government of Afghanistan that WHO will extend its fullest support in improving cancer prevention, treatment and care for all Afghan people, but I would like to broaden it for non-communicable diseases overall. Thank you very much for your kind attention.
There is a say that it takes one person to change the world, and I really want to start with praising the effort of Ambassador Karukhel and Khala Fawziya, who's in Germany now, and the championship of the First Lady. But above all, I want to praise, if you look around and you will see these wonderful ladies in green scarf, I want to praise the team of volunteers, male and female, who are actually giving their time and efforts to fight the cancer in this country. The beauty of speaking after Dr. Rick, he usually say everything I want to say, and I end up saying, Assalamu alaikum, Khuday Hafiz. I'm honored to be here among you today on behalf of the Health Partner Development Partner Forum to witness the great work the Afghanistan Cancer Foundation is undertaking to reduce the burden of cancer in Afghanistan. Current statistics indicate that 40% of cancer cases could be prevented. Another 40% could be detected early and treated, and suffering of patients could be reduced with a professional care and well-equipped care facilities. And this is what its Cancer Foundation, our objective and is about. As a partners, we greatly appreciate the Ministry of Public Health effort in establishing an uncommunicable disease unit in order to develop relevant policies and strategies to fight cancer in line with the World Health Organization guidelines. The National Non-Communicable Disease Control Strategy of 2015-2020 confirms the importance of establishing cancer registry as well as developing a national cancer control plan. We welcome the recent support of the International Atomic Energy Agency and the World Health Organization in assisting Ministry of Public Health to undertake a comprehensive assessment of cancer control program is a valuable start to engage development partner and international specialized entities in this process. With the upcoming Sahat Mandi National Health Program, we have an opportunity to update all the health packages to include some of the most cost-effective interventions with regards to the non-communicable diseases, including cancer, and with focus on cancer. The Joint World Health Organization, International Atomic Energy Agency, and Ministry of Health mission in early May will hopefully guide the government and the partners in this area. In conclusion, allow me, ladies and gentlemen, to extend to all of you our Health Development Partner Forum best wishes for a tangible success in your second session and for the well-being of Afghan people, particularly those cancer patients who's looking for the second chance in life to survive. May Allah bless every step you take and every effort you do for the well-being of Afghan people, and especially for those patients waiting for your help. Thank you.